Hello, my name is Dr. Heather Lau. I'm an assistant professor in the Division of Neurogenetics at the NYU School of Medicine. Today we will be speaking about adult polyglucosan body disease, APBD. In the talk today, we will review a few points. What is APBD? What are the symptoms and signs of APBD? Misdiagnosis and its implications. What is the cause of APBD? How is it diagnosed? The management of symptoms related to APBD, and some information about what can you do to help. What is APBD and what are the symptoms? Adult polyglucosan body disorder is an inherited adult-onset progressive disorder that affects the nervous system. The disease may present in the 50s and 60s, but some patients may experience symptoms as early as age 35. The typical symptoms of APBD include loss of sensation in the lower extremities, typically characterized by numbness initially, bladder dysfunction, which is characterized by difficulties in control of the flow of urine and urinary retention, walking difficulties, due to a combination of weakness in the lower extremities and stiffness known as spasticity. Finally, memory can be impaired in APBD in up to 50% of patients. This typical sign occurs later in the course of the disease. APBD is frequently misdiagnosed. For patients that present with urinary symptoms in their 50s, they may be misdiagnosed as benign prostatic hypertrophy. Up to 50% of men with APBD are misdiagnosed as having this. Peripheral neuropathy, multiple sclerosis, stroke, and cerebral small vessel disease are all other neurologic misdiagnoses. ALS, spine disease, including myelopathy, and other white matter diseases called leukodystrophies. Complications of diabetes, side effects of chemotherapy, and even a separate genetic disorder called hereditary spastic paraparesis could all be misdiagnosed first. Misdiagnosis may lead to patients receiving inappropriate therapies and expose them to the risk of complications related to these diagnoses. In a certain series of 30 patients, all were initially misdiagnosed by their neurologist. It is a diagnostic journey for many of these patients. 27% of these patients received inappropriate therapies. So what is the cause of APBD? APBD is caused by a genetic mutation. It is inherited in an autosomal recessive pattern due to a mutation in the gene called GBE1. Both copies of the gene need to be mutated to cause disease. Couples who are both carriers of this abnormal gene have a 25% chance of having a child affected with this disease. APBD is a pan-ethnic disorder, but more frequent in patients of Ashkenazi Jewish heritage due to the presence of founder mutations. One particular GBE1 pathogenic variant is tyrosine 329 serine. This is the most common finding in the Ashkenazi Jewish patients. A new intronic mutation was recently found by research done by Dr. Achman. And this is also the second most common mutation in Ashkenazi Jewish patients. What does GBE1 gene do? GBE1 gene encodes a protein called glycogen branching enzyme. Mutations in this gene lead to a deficiency of this enzyme. Glycogen branching enzyme is important in the proper creation of glycogen, a storage form of glucose. This is an important source of energy for the body. When the enzyme is deficient, it leads to the accumulation of abnormal glycogen molecules called polyglucosan bodies. And these are deposited in the brain, spinal cord, and peripheral nerves. These glycogen molecules cannot be used for energy and are thought to disrupt the normal function of nerve cells, leading to the symptoms described. APBD is a type of glycogen storage disorder. Glycogenoses are estimated to occur in 1 in 10,000 people. APBD accounts for about 3% of these glycogenoses. Although APBD is a rare disorder, the estimated carrier frequency in people with Ashkenazi heritage ranges from 1 in 35 to 1 in 68. However, we do believe that it's underdiagnosed. How is APBD diagnosed? The triad of symptoms of urinary dysfunction, gait difficulty, and sensory loss should prompt a workup for APBD. Initial diagnostic testing includes neurologic consultation and examination, urologic consultation and urologic studies, brain and spine imaging to evaluate for other causes, nerve and muscle electrophysiologic testing, and blood and urine tests. Specific testing for APBD is available. Originally, sural nerve biopsies were done. They're useful because they demonstrate the accumulation of these polyglucosan bodies in nerves. However, now that we understand that GBE1 encodes an enzyme, we can look for the enzyme activity in a blood sample. Once we demonstrate that that enzyme activity is low, we can then sequence the GBE1 gene in patients based on a blood or saliva test. Management of symptoms of APBD. There is no cure for APBD at this time. Treatment is directed at managing the symptoms. Management requires a multidisciplinary approach. This team approach includes a variety of doctors, geneticists to confirm the diagnosis and to provide counseling about inheritance and risk to family members, a neurologist who will obtain baseline MRI of the spine and brain, may perform nerve and muscle studies, and possibly perform memory assessments. The urologist will assess bladder function, help with the management of any urinary symptoms, especially with urinary retention. He may prescribe antispasmodic medications and sometimes bladder catheterization. He will also be involved with prompt identification and treatment of recurrent bladder infections, which is a major cause of morbidity for these patients. A psychologist or behavioral neurologist may be involved to help with cognitive decline and to manage any particular mood disorder that may arise. Finally, a physical medicine rehab physician is integral to these patients' health to guide physical therapy, to assess the need for gait stability by prescribing safety devices such as canes, walkers, and wheelchairs. This is to prevent falls and injuries. It is important to establish care with these physicians to establish the extent of the disease, to prevent the secondary complications. Periodic assessments and reassessments of these symptoms should be done on an annual basis. For more information and how can you help? For more information, you can reach out to the Adult Polyglucosan Body Disease Research Foundation. This foundation funds both basic science and clinical studies to help delineate the pathophysiology of the disease and to identify potential therapies. Their website maintains a database of physicians familiar with APBD for referrals. Information on how to obtain testing and other information regarding the disease and current research efforts are maintained on this website. How can you help? Natural history studies are integral to developing potential therapies. We need to define the range of disease symptoms and severity among patients, as well as the differences in rate of progression. With this information, it would be helpful to define clinical measurements that would aid in the testing of potential therapies in clinical trials. For more information, there is a link to the natural history study at the bottom of this lesson page. To review, APBD is an adult-onset disease affecting urination, walking, sensation, and memory. It is frequently misdiagnosed and likely underdiagnosed. It has a higher prevalence in the Ashkenazi Jewish community. Diagnosis is made by demonstrating low GBE1 enzyme activity and confirmed by genetic sequencing of this gene. There is no current cure, but treatment is symptomatic and management requires a team of specialists. Research into the understanding of the disease and potential therapeutic interventions is ongoing. Participation in a natural history study is important in assisting scientists and physicians to learn more about the disease and help guide research for possible treatments. Thank you for listening. For more information, please look at the links and resources listed on the bottom of this lesson page. Thank you.